Welcome, everyone, to this informative video about Chalazion, a common yet often misunderstood eye condition. We'll delve into what a chalazion is, why it occurs, how it's diagnosed, and the various treatment options available. By the end of this video, you'll have a comprehensive understanding of this condition and how to manage it effectively. So, what causes a chalazion? The primary culprit is a blockage of the meibomian glands. These glands are located in the eyelids and are responsible for producing an oily substance called meibum. This meibum is a critical component of our tears, helping to lubricate the eye and prevent tear evaporation. When these glands become blocked, the oily secretions build up, leading to inflammation and the formation of a chalazion. Let's break down the pathophysiology. When a meibomian gland becomes blocked, the oil it produces can't be released normally. This trapped oil and cellular debris accumulate within the gland. The body recognizes this as a foreign substance and initiates an inflammatory response. This inflammation results in the formation of a small, painless lump within the eyelid that's the chalazion. Over time, this inflammation can become chronic, and the chalazion can become more firm and persistent. Chalazia are a very common occurrence, affecting people of all ages and ethnicities. While specific epidemiological data can vary depending on the region and study, it's generally accepted that a significant portion of the population will experience a chalazion at some point in their lives. People with certain pre-existing conditions, such as blepharitis or rosacea, may be more prone to developing chalazion. The most noticeable sign of a chalazion is a small, painless lump in the eyelid. It may start as a tender area, but often becomes painless over time. The lump can be located on the upper or lower eyelid, and its size can vary. Sometimes a large chalazion can press on the cornea, causing blurred vision. In rare cases, if the chalazion becomes infected, you may experience redness, warmth, and pain. Diagnosing a chalazion is usually straightforward and can be done through a simple physical examination by an eye doctor or primary care physician. The doctor will examine your eyelids and the surrounding area to assess the size, location, and characteristics of the lump. Typically, no special tests are needed. The diagnosis is primarily based on the clinical appearance of the lesion. While we don't typically classify chalazion into distinct types, it's helpful to differentiate them based on their characteristics. A small, early-stage chalazion may be barely noticeable, while a larger, more established chalazion can be more prominent. Also, if a chalazion becomes infected, it's sometimes referred to as an inflamed chalazion. The treatment for chalazion depends on its size and severity. Many small chalazia will resolve on their own within a few weeks or months with conservative management. This includes warm compresses applied to the eyelid several times a day to help soften the oil and promote drainage. Gentle eyelid massage can also be beneficial. If the chalazion persists or is causing significant discomfort, other options include topical or injected corticosteroids to reduce inflammation, or surgical incision and drainage to remove the contents of the chalazion. Antibiotics are typically not necessary unless there's a secondary bacterial infection. While it's not always possible to completely prevent chalazion, there are steps you can take to reduce your risk. Good eyelid hygiene is crucial. This includes regularly cleaning your eyelids with a mild cleanser or eyelid wipes, especially if you're prone to blepharitis. If you wear contact lenses, be sure to follow proper hygiene practices to avoid introducing bacteria to your eyes. Managing underlying conditions like rosacea can also help prevent chalazion. The prognosis for chalazion is generally excellent. Most chalazion resolve on their own or with simple treatments. Recurrence is possible, but can often be managed with continued good eyelid hygiene. Recent research is focusing on developing more effective and targeted therapies for meibomian gland dysfunction, the underlying cause of many chalazion. These advancements may lead to new treatment options in the future. Thank you for watching. We hope this video has provided you with valuable information about chalazion.